Hi everyone, welcome to Belly Strong. So today's topic is carpal tunnel syndrome, which is another condition that pregnant women seem to get. If you haven't subscribed to the channel already, subscribe and check out our videos like this on other conditions that tend to crop up during pregnancy. But for today, we'll cover the basics of what carpal tunnel syndrome is and some of the things that you can do in order to help relieve some of these symptoms. So before we get into the carpal tunnel, just to chat a bit about the nerves that go to the hand. So the nerves that go to the hand, they start in the neck, they go down underneath the collarbone, through the arm, into the hand where they supply sensation and movement to the hand. The carpal tunnel is a tunnel that sits here, and one of the nerves that goes to the hand, the median nerve, passes through this carpal tunnel. If the pressure builds up in this carpal tunnel, it squeezes down onto the nerve, and that is what causes carpal tunnel syndrome. During pregnancy, this is often caused by fluid retention or swelling, increasing the pressure in that carpal tunnel, putting more pressure on the nerve. And it can also be exacerbated by repetitive hand movements. So if you have a manual job, or if you're working a lot at the computer with a mouse, these sorts of repetitive movements can make the symptoms worse. So what you'll feel with carpal tunnel is pain, tingling, numbness, or burning in the hand, and mostly or notably these three fingers here, which is the area that is supplied by the median nerve. It can also be worse at night because when you lay down, the pressure or the fluid tends to accumulate in the upper body, which increases the pressure in that carpal tunnel. Something that may also make it worse is poor posture. So if you're someone who looks like this, with rounded shoulders and a chin poking forward, it puts more pressure on the nerves that go under the collarbone here, and also more pressure on the nerves as they exit through the neck. And that can exacerbate neural problems in the arm. Something that can also cause numbness or tingling in the hands during pregnancy is a condition called pre-eclampsia, or really high blood pressure. And typically the numbness or tingling here is in the whole hand instead of just these three fingers, and often accompanied by other symptoms like headaches, blurred vision, swelling in the face, very dark urine, or very sudden weight gain. And if you notice any of these symptoms, it's really important to consult a doctor immediately because preeclampsia can be very dangerous for you and the baby. If you do indeed have carpal tunnel syndrome, there are some things that you can do to help. So if you are retaining water or retaining fluid, you can help deal with this by drinking a lot of water, which is counterintuitive. But if the body feels dehydrated, it'll tend to hold onto more water, which can make fluid retention worse. So making sure that you're well hydrated throughout the day is important. Also avoid foods like caffeine and sodium, which hold onto water and make swelling worse. You can eat potassium-rich foods like bananas, spinach, or beans, which help counteract the effect of sodium. And wearing loose clothing instead of tight-fitting clothing, especially around the upper body, can help with circulation and fluid retention. It's also important to move and stretch frequently throughout the day, especially if you have a desk job, and making sure that you're not sitting like this at your desk, but you're upright, straight, open to relieve some of the pressure on the nerves that you may have in the upper regions of the body. What can be really useful for a carpal tunnel is wearing a wrist splint to give the wrist a bit of support, or even having your wrist taped up by a professional. And it's important when you're wearing a splint or if you're using taping that you are still getting the wrist moving to help with circulation or fluid movement around that carpal tunnel, and not keeping it fixed, static, and not moving throughout the entire day. Because carpal tunnel can often be worse at night, lying with your hand elevated or a little bit higher than you if you're lying on your side can often help. But sometimes this can be a bit difficult during pregnancy with difficulty turning or, being unable to lie on your back while you sleep. But if you can manage to do it, it may be helpful to elevate that arm at night and even wear a splint at night too. Now, there are also some specific exercises and releases that you can try to help relieve the symptoms of carpal tunnel. Now, neural conditions or conditions affecting nerves are generally quite irritable and it's easy to do too much. So in the beginning, I'd recommend starting off with very few reps and doing little bits of these movements or these exercises regularly and frequently throughout the day rather than having a long session where you're going through some of these releases. The first one is called the prayer stretch, and easy to remember, you get your hands into a prayer position, and the first thing that you want to do is just bring the hands down, so we're getting a bit of wrist extension, and up. So you can mobilize into that stretch, hold it for a couple of seconds, and then come up. And this is stretching out the carpal tunnel area, stretching out some of the muscles along the front of the wrist or some of the tendons along the front of the wrist. And you can do that 8 to 10 times if you can handle a longer stretch without your symptoms increasing. You can hold that for 15 to 20 seconds. The next one is just some wrist movements, and this is going to help get the fluid moving around the carpal tunnel. So you can have your arm in front of you in a fist position, and you're just taking that wrist down and up, down and up. So really simple. This is something that you can do while watching TV, but getting all those structures moving around that carpal tunnel. Once that's easy, you can add a finger extension. So doing this with your hands straight instead of in a fist, which puts a little bit more pressure, puts a bigger stretch on some of those structures. If that is well tolerated, you can do 8 to 10 reps of this. Then you can take that palm up, wrist back, and pull the wrist towards you, which gives you a much bigger stretch on that wrist. And in this position, you'll hold it and add a head nod and coming back up, down and up. And what this is doing is it's introducing a glide or a movement of that nerve from the neck all the way down to the wrist, called a neural glide. And you can do that 8 to 10 times. That's one that you don't want to do too much because it can aggravate your symptoms. But again, start small and see how much you can tolerate. The last one is a pec stretch and a neck stretch. So you'll take your hands, clasp them behind your back to really open that chest. And then what you want to do is turn your head away from the side that you feel the symptoms. So if my right side is painful, I will turn my head to the left and then take my head back a bit to feel a stretch here and in the chest area. And this is helping to relieve some of the pressure that you could have on the upper parts of that nerve or where the nerve comes from. And you can hold that for 15 to 30 seconds, and this is good to use in combination with postural corrections. So it won't help as much if you're doing that stretch, but you're still sitting like this, as opposed to if you're doing that stretch, but also working on your posture. So those are some things you can start off with. And as always, if symptoms really aren't getting better and you're struggling, I'd really recommend seeing a physiotherapist for an individual assessment and treatment program. Often carpal tunnel syndrome does resolve after delivery and your body starts to get rid of that fluid, but you don't have to wait until after delivery to hopefully get some relief. Just a reminder to subscribe to the channel to see more videos like this. Have a look at some of our workout videos to keep you moving and fit during pregnancy. And I will see you again on Belly Strong.